Understanding Yin-Yang attributes, exploring the dual nature of existence through Yin and Yang concepts. Yin-Yang is not just a concept, but a framework for understanding the dual nature of reality, where opposites coexist and shape one another. It emphasizes the balance between dynamic and static forces, highlighting their essential roles in the universe's continuous cycle of change. Yang attributes represent active outward energies characterized by dynamic qualities that promote growth and visibility. These attributes are associated with warmth, brightness, and functionality, reflecting a proactive and invigorating nature that drives excitement and progress in various aspects of life. Yin attributes embody passive inward energies defined by stable qualities that emphasize rest and nourishment. These attributes are linked to coldness, dimness, and materiality, reflecting a nurturing and calming essence that fosters inhibition and stagnation, essential for balance and reflection in life. Yang attributes are characterized by dynamism, indicating a state of activity and transformation. They embody movement and the drive for progress. Yang's external nature points to its expression in the outer world, emphasizing interactions with the environment and other entities. The ascending aspect of Yang represents growth, aspiration, and the journey towards higher states or goals, symbolizing upward movement. Yang is associated with warmth, reflecting energy, vitality, and an active spirit that enhances life and encourages interaction. Brightness is a key characteristic of Yang, symbolizing clarity, visibility, and enlightenment, bringing things into focus and understanding. Yin attributes are characterized by their stability and the ability to create a sense of rest and peace. They provide a foundation for growth and activity to occur in the Yang. Yin attributes focus on the internal aspects of existence, emphasizing introspection and inward experiences rather than outward actions. Yin attributes are often associated with a descending nature, reflecting a grounding force that symbolizes stability and permanence, in contrast to the upward motion of Yang. Yin attributes convey a sense of coldness, often linked to calmness and tranquility. This can provide a counterbalance to the heat and energy associated with Yang. Yin attributes are connected to dimness and obscurity, symbolizing the hidden and mysterious aspects of existence that contribute to depth and complexity. Yin and Yang theory posits that all things and phenomena are interconnected and can be understood through their Yin and Yang attributes. This framework serves as the foundational principle governing relationships and changes within the universe, underlying life and existence itself. The nature of Yin and Yang is contingent upon context, meaning that a phenomenon's classification as Yin or Yang is not fixed, but depends on its relationship to other elements. This relativity emphasizes that every aspect of existence can embody both Yin and Yang characteristics, illustrating a dynamic interplay of opposites within any given situation. Yin and Yang are not only distinct forces, but also infinitely divisible, allowing for a nuanced understanding of the relationship within various contexts. Within every expression of Yin and Yang, there exists a duality, meaning that each contains elements of the other, enhancing the complexity of their interaction. Daytime, characterized by brightness and activity, aligns with Yang, while nighttime embodies coolness and rest, representing Yin. The morning symbolizes Yang with Yin-Yang due to increasing light and energy, while the afternoon represents a gradual shift towards Yin as day transitions to night. Mutual transformation of Yin and Yang, understanding how Yin and Yang dynamically influence each other, enhances our grasp of the universe's balance. Yin and Yang are in a constant state of flux, adapting to changes in the environment. As conditions evolve, attributes of Yin can transform into Yang, reflecting the interconnected nature of these forces. Every phenomenon can be categorized within the Yin and Yang framework, highlighting their dualistic relationship. Yin and Yang symbolize the essential duality that underpins all phenomena, serving as a guiding framework for understanding the interconnectedness of opposites. This theory not only applies to natural elements, but also extends to human interactions, health, and philosophical perspectives, promoting a holistic view of existence and change.
Let's discuss understanding the relationship between the five sides of qi transportation and the yin organs. Exploring the connections between the five sides of qi transportation and their corresponding yin organs, highlighting clinical significance and practical implications. Qi transportation is a fundamental principle in TCM that refers to the movement and distribution of qi, or vital energy, throughout the body. Understanding this concept is crucial for maintaining balance, promoting healing, and ensuring overall health and wellness. Overview of the five yin organs. The liver neck connection. Liver is associated with the neck region. Disharmonies such as liver qi stagnation often manifests as discomfort or stiffness in the neck. The heart chest connection. The heart governs emotional health and is closely connected to the chest area. Issues like stress can lead to disturbances in heart function affecting the chest. Lungs upper back connection. The lungs are linked to the upper back and shoulders. Conditions such as lung heat can result in pain in these areas, emphasizing the importance of lung health. Kidneys, thighs, and lower back connection. The kidneys correspond to the thighs and lower back. A decline in kidney energy can lead to weakness in these areas, demonstrating the kidney's crucial role in overall strength. Spleen, spine connection. The spleen affects the spine with specific acupuncture points such as spleen 3, Tai Bai, used to support spinal alignment and health, showcasing the spleen's influence. The concept of qi in traditional Chinese medicine. Qi is the vital energy that circulates through the body, playing a crucial role in health and wellness. It is intricately connected to the five yin organs and their designated sites of qi transportation, influencing both physical health and emotional well-being. The five sites of qi transportation. Understanding the connections between the yin organs and their corresponding sites of qi accumulation. The neck. It's associated with the liver, often affected by disharmonies like liver qi stagnation. The chest is connected to the heart, where emotional stress can lead to various health issues. The upper back and shoulders are linked to the lungs, frequently impacted by lung heat, causing discomfort. The thighs and lower back are related to the kidneys. Weakness may arise from declining kidney energy. The spine corresponds to the spleen, which influences spinal health and alignment. Neck and liver, the connection and clinical relevance. The liver is closely associated with the neck, where disharmonies like liver stagnation can manifest. This stagnation often leads to tension and stiffness in the neck, indicating a disruption in the flow of qi. Clinically, a stiff neck may signal underlying liver issues, requiring treatments aimed at relieving qi stagnation. Techniques such as acupuncture and herbal remedies targeting the liver are often employed to restore balance and alleviate symptoms. Understanding the relationship of the chest and the heart. Heart corresponding to the chest is essential for blood circulation and emotional well-being. Issues like emotional stress can lead to disharmonies affecting heart function and overall health. Upper back and shoulders, lungs, and their disharmonies. The upper back and shoulders are closely linked to lung health, with disharmonies such as lung heat leading to discomfort in this area. Treatment of these issues often focuses on relieving heat and promoting proper qi flow. Maintaining lung health is essential for overall respiratory function. affecting not only breathing, but also the flow of qi throughout the body. Healthy lungs contribute to better oxygenation and vitality. Thighs and lower back, the kidney energy and weakness. Kidney energy supports strength. The decline affects lower back. Kidneys influence thigh strength, common signs of weakness, and a holistic approach to treatment. The influence on structure and function of the spine and spleen. The spleen plays a critical role in maintaining the health of the spine, as its disharmonies can lead to structural and functional issues. Specific acupuncture points, like spleen T, are utilized to enhance spinal alignment and overall well-being. Clinical implications and practices. Understanding the relationship between the five sides of qi, transportation, and the yin organs for effective diagnosis and treatment. The spring, the east wind, signifies a time when the liver is commonly affected, often resulting in conditions that impact the neck area, such as liver qi stagnation. The summer, the south wind indicates that the heart is prone to disorders affecting the chest and hypochondrial region, necessitating specific treatment strategies. In the autumn, the west wind brings attention to lung health, where issues like lung heat may cause upper back pain, highlighting the need for appropriate intervention. In the winter, the north wind emphasizes kidney health, with energy decline causing weakness in the thighs, influencing treatment plans. The Earth Center, the spleen's influence on the spine, highlights its importance in maintaining structural integrity and functional health, guiding specific interventions. The five sites of qi transportation corresponds to the yin organs, with each site reflecting specific health implications. The neck is linked to the liver, the chest to the heart, the upper back and shoulders to the lungs, thighs and the lower back to the kidneys, and the spine to the spleen. Recognizing these connections enhances the understanding of these harmonies and their clinical relevance, emphasizing the importance of maintaining qi balance for overall health.
The small intestine Luo-Connecting Vessel system, exploring the complex structure and clinical relevance of the small intestine Luo-Connecting Vessel system. The small intestine Luo-Connecting Vessel system serves as a critical component in the network of meridians, facilitating the flow of energy between the small intestine and other vital organs. Its unique structure and connections enhance the integration and balance of physiological functions within the body. The small intestine Luo-Connecting Vessel system plays a vital role in the body's energy pathways by connecting the small intestine primary channel to other channels. This connection facilitates not only the flow of energy, but also supports the interaction between various organ systems, particularly the heart. Pathway of the SI Luo-Connecting Vessel. The SI Luo-Connecting Vessel branches off from the small intestine primary channel at SI7, its Luo-connecting point. This separation marks the beginning of its distinct pathway that plays a critical role in energy distribution. The vessel forms a complex three-dimensional reticular network which divides into various branches and sub-branches, effectively enhancing the communication between the small intestine and other related channels. Branches and sub-branches of the SI Luo-Connecting Vessel. The SI Luo-Connecting Vessel forms multiple branches and sub-branches, including Sun Luo, Fu Luo, and Shui Luo, creating a complex reticular network within the surrounding tissues. Horizontal divisions of the SI Luo-Connecting Vessel run towards the paired heart primary channel, facilitating energy connection and flow between these vital organs. A longitudinal division of the SI Luo-Connecting Vessel runs to the medial condyle of the humerus and ascends to the shoulder, where it may terminate or continue to other points, depending on different schools of thought. The SI Luo-Connecting Vessel establishes a crucial link within the heart primary channel at the Yin source point, heart 7. This connection enables the flow of energy between the small intestine and the heart, supporting the balance and functionality of both organs. Longitudinal division and shoulder connection. The longitudinal division of the SI Luo-Connecting Vessel runs toward the medial condyle of the humerus, indicating a direct path along the upper arm. This pathway is crucial for facilitating energy flow to the shoulder area. At TNU, LI15, the SI Luo-Connecting Vessel establishes a connection with the shoulder, which is critical for integrating movements and energy between the arm and shoulder. Certain schools of thought suggest that the vessel may continue beyond the shoulder, traversing the acromion to connect with stomach 12 in the supraclavicular fossa. This connection emphasizes the importance of the thoracic region in the energy flow of the body. The SI Luo-Connecting Vessel plays a crucial role in maintaining the balance of energy within the body. Its connections to both the small intestine and heart channels are essential for diagnosing conditions related to joint stability and overall vitality. Pathology, excess conditions, weak and unstable joints, weakness in the elbow, paralysis of the arm. Deficiency conditions, we have warts on the skin, fatigue and weakness, digestive issues, sensitivity to cold, muscle weakness. The small intestine Luo-Connecting Vessel system is essential for facilitating energy communication between vital organs, particularly the small intestine and heart. Understanding its pathways and clinical significance aids in diagnosing and treating related health issues effectively.
Let's discuss history of Chinese tongue diagnosis, exploring the evolution and integration of tongue diagnosis in traditional and modern Chinese medicine. Tongue diagnosis is a fundamental aspect of TCM, serving as a window into the patient's health. Its significance has grown considerably, especially since the establishment of the People's Republic of China in 1949, where it has seen a resurgence alongside modern medical practices. Overview of TCM post-1949. Since the establishment of the People's Republic of China, there has been a significant enhancement in healthcare services, leading to improved overall health for the population. The government's focus on healthcare reform has played a crucial role in this transformation. The revival of TCM has been noteworthy, with increased academic interest and public awareness. TCM practices, including acupuncture and herbal medicine, have gained recognition and respect. They are integrated into mainstream healthcare. The study of TCM now occurs alongside Western medical education and practices. This integration fosters a comprehensive approach to patient care, allowing practitioners to utilize the strengths of both systems for better health outcomes. Renaissance of traditional Chinese medicine. Significant healthcare improvements post-1949, the revitalization of traditional therapies, growing number of specialized hospitals, increased emphasis on research, and publication boom in medical literature. Educational advancements in TCM, tracing the evolution and impact of educational institutions and methodologies in Chinese medicine since 1949. In 1949 to 1950s, allowing the establishment of the People's Republic of China, traditional Chinese medicine underwent significant modernization, leading to the establishment of colleges focuses on this field. 1960s to 70s. During the Cultural Revolution, traditional medicine was largely neglected, but foundational colleges remained, setting the stage for future advancements when traditional practices regained recognition. 1980s to 90s. A renaissance in TCM occurred with an increase in the number of colleges offering 5 to 6 year curricula and specialized training of TCM continues to thrive with modern teaching methods, including the use of visual aids and technology in the curriculum, enhancing the learning experience. (2000s to present). Colleges of TCM continue to thrive with modern teaching methods, including the use of visual aids and technology in the curriculum, enhancing the learning experience. Recent publications on tongue diagnosis. Recent studies and publications emphasize the integration of traditional and modern medical insights through tongue diagnosis. 12 is a color photographs of Chinese medical diagnosis highlighting clinical aspects. 524 patients studied with chronic hepatitis B, revealing tongue diagnosis correlations. 32% patients presenting damp heat as indicated by tongue appearance, while 22% with stagnation of qi and accumulation of dampness. 3% of patients with spleen and kidney deficiency as per tongue diagnosis. Integration of Chinese and Western diagnostic techniques. Chinese diagnosis emphasizes the holistic view of health, using tongue appearance as a key indicator of internal conditions. This method allows practitioners to identify underlying patterns and contribute to tailored treatment plans based on individual observations. Recent studies demonstrate how tongue characteristics correlate with various biomedically defined diseases, thus integrating traditional techniques with modern medical insights. In contrast, Western diagnosis typically focuses on underlying specific diseases based on defined symptoms and clinical tests. This approach often relies on laboratory results and imaging, leading to a more segmented view of health. While effective in many situations, it may overlook broader diagnostic indicators, such as those provided by tongue analysis in TCM.
Understanding the structure of the pulse, exploring the intricate relationships between pulse positions, organ associations, and diagnostic interpretations in traditional medicine. The pulse is initially palpated in 9 distinct locations on the body, each site corresponding to specific Zhang organs and the 3 Tiao. This foundational understanding provides a framework for pulse diagnosis. The 3 positions in the head and neck are indicative of the body's higher functions and health, serving as key diagnostic touchpoints for pulse examination. 3 pulse locations on the torso reflect the central organs and their dynamic states, often providing insights into overall health and vitality. The 3 pulse positions on the legs are related to the lower body functions and represent foundational health, connecting to the earth aspect of the body's continuum. 3 areas of the body: heaven, man, and earth. Heaven, upper body pulse; man, torso pulse points; earth, lower body pulses. The pulse depths provide vital insights into the body's health status, revealing layers of internal and external conditions. Superficial indicates external conditions and the body's response to environmental factors. Middle reflects a balance, integrating both internal health and external influences. Deep relates to the internal organ health, revealing deeper issues within the body systems. The pulse is analyzed on three distinct planes. The horizontal plane, which features three positions along the artery, Chun Quan Shu. The vertical plane, which incorporates three depths, superficial, middle, and deep, and a third dimension represented by the width of the pulse. This comprehensive structure allows for a nuanced understanding of the pulse, linking its characteristics to the health and various organs and the dynamics of the body's chi. Dynamic versus rigid definitions of pulse positions. The dynamic approach to pulse diagnosis focuses on the changes in the pulse as reflections of fluctuations in the body's chi. This perspective allows practitioners to interpret the pulse not only in terms of fixed positions, but also in relation to the overall health and energy of the body. This method embraces flexibility and seeks to understand the interconnectedness of organ pairs, reflecting their simultaneous activities. In contrast, the rigid approach maintains strict definitions for pulse positions, linking specific depths to corresponding organs or channels. Here, the deep level is often associated with Zhang organs, while the superficial level pertains to the Fu organs. This perspective can create confusion as it may overlook the dynamic interplay of qi and the holistic nature of the body's functioning. The relationship between pulse and organ pairs. The pulse is palpated in 9 distinct locations on the body, each corresponding to various Zhang organs and their associated qiao. This structured approach facilitates a clear diagnosis of organ health and interrelationships. The pulse's three-dimensional structure includes 3 horizontal positions and 3 vertical depths, allowing for a comprehensive understanding of organ function. The dynamic relationship between organ pairs is evident in pulse diagnosis, where changes in one organ's pulse can indicate shifts in the paired organ's condition, reflecting the body's overall qi balance. Case study: ascendant liver yang versus stomach qi deficiency. The pulse manifestation of ascendant liver yang typically presents as full, wiry, and superficial pulse located in the left Quan position, indicating excess of liver yang energy. In contrast, stomach qi deficiency is characterized by a deeper, weak pulse found in the right Quan position, signifying a deficiency in stomach qi that affects the overall vitality. The diagnostic relevance of pulse positions, initially palpated at 9 distinct locations related to the Zhang organs and the 3 qiao, emphasizes the importance of understanding both the depths and positions of the pulse. The pulse's two-dimensional structure, consisting of length and depth, evolves into a three-dimensional form, where width also bears significance. A dynamic approach to pulse diagnosis, viewing changes in the pulse in relation to the body's qi, enhances holistic health assessments and informs treatment strategies.
Let's discuss holographic theory and scalp acupuncture, exploring the intersection of holographic theory and scalp acupuncture in holistic health. Holographic theory serves as the basis for scalp acupuncture and other microacupuncture systems, suggesting that the human body functions as a cohesive whole. Each part of the body mirrors the whole, allowing for targeted treatments through specific areas such as the scalp, which represents different organs and functions of the body. Scalp acupuncture, rooted in holographic theory, treats diseases by targeting specific points on the scalp that corresponds to various organs in the body. By stimulating these points, practitioners can influence the health of the Zangfu organs, facilitating healing processes throughout the body. The connection between holographic theory and scalp acupuncture. Scalp acupuncture operates under the principle of holographic theory, reflecting the idea that each part of the body represents the whole. This connection allows for targeted treatment through scalp stimulation. Specific points on the scalp correspond to the Zhang organs, allowing practitioners to target specific health issues based on the location of these points. Stimulating the appropriate areas on the scalp not only opens the meridians, but also harmonizes the yin and yang, enhancing overall health and addressing specific diseases. The human body is a complete unit. Holographic theory emphasizes that the human body functions as a complete unit, where every part reflects the whole. This interconnectedness is essential for practices like scalp acupuncture, which relies on the stimulation of specific scalp areas to influence corresponding organs and systems throughout the body. Scalp representation of the human body. The scalp serves as a microcosmic representation of the entire body, correlating specific points with Zhang organs and various health conditions. The Zhang organs, these are vital organs that store essential substances. The Fu organs, these organs are involved in digestion and excretion. Specific health conditions, where each point on the scalp correlates with particular health issues. A complete body representation, the scalp serves as a holographic map of the entire human body. Holistic treatment approach by stimulating scalp points can influence overall health and well-being. Stimulating the scalp, the mechanism understanding the physiological processes involved in scalp acupuncture. By opening the meridians, scalp stimulation facilitates the flow of qi through the meridian pathways, promoting overall balance. Harmonize yin and yang. Targeted acupuncture on the scalp encourages equilibrium between yin and yang energies, essential for health. Regulate Zhang organs. Specific scalp points correspond to the Zhang organs, enhancing their functions and aiding in disease treatment. Effects on Zhang organs. Stimulating specific areas of the scalp enhances the overall function of the Zhang organs, leading to improved health outcomes and disease management. Scalp acupuncture harmonizes the flow of qi, ensuring that energy circulates freely throughout the body, which is essential for maintaining health and well-being. By targeting the central organs, scalp acupuncture effectively addresses specific diseases such as digestive issues, respiratory ailments, and emotional disorders, improving overall health. Clinical research insights, exploring the effects of scalp acupuncture as revealed by clinical studies. In recent studies, research indicates that scalp acupuncture effectively adjusts cerebral functions, enhancing cognitive performance and neurological health. Blood flow enhancement and clinical findings show that stimulating scalp areas significantly increases blood flow in the brain, improving overall brain health and function. Motor sensory function improvement. Studies highlight the role of scalp acupuncture in enhancing the motor and sensory functions of the four extremities, aiding rehabilitation processes. Benefits of scalp acupuncture. It enhances cerebral blood flow, supports motor function improvement, regulates the yin and yang, enhances vascular elasticity, and improves overall health outcomes. In conclusion and future directions, scalp acupuncture is rooted in holographic theory, emphasizing the interconnectedness of body, these systems, its capacity to influence organ function, enhance cerebral performance and improve vascular health highlights its potential as a therapeutic modality, warranting further exploration and research for broader applications.
Chinese auricular zones, an overview, an in-depth exploration of the anatomical zones of the ear according to traditional Chinese medicine. The auricular zones in TCM are mapped regions on the ear that correspond to various organs and systems within the body. Understanding these zones allows practitioners to diagnose and treat health conditions through auricular acupuncture and other therapeutic techniques. Helix 1 is situated at the helix screws, marking the beginning of the helix zones. The section from the helix screws notch to the upper border of the inferior antihelix screws is divided into 3 equal parts, known as helix 2, 3, 4. Helix 5 is positioned between the upper border of the inferior antihelix screws and the lower border of the superior antihelix screws, continuing the helix structure. The numbering progresses to helix 6 at the apex of the auricle, with subsequent divisions leading to helix 12. Helix 1, helix screws. Helix 2, upper inferior antihelix. Helix 3 is middle inferior antihelix. Helix 4, lower inferior antihelix. Helix 5, between antihelix crura. Helix 6, apex of auricle. Helix 7, apex of tubercle. Helix 8, tubercle borders. Helix 9 to 12, from tubercle to cauda. Scaphoid fossa zones. SF6 is the zone located near the earlobe, serving as the lowest point of the scaphoid fossa. SF5 is the next zone up from SF6, representing the lower middle portion of the scaphoid fossa. SF4 is the middle portion of the scaphoid fossa. SF3 is the zone located second from the top. SF2 is situated near the top of the scaphoid fossa. SF1 is the top zone of the scaphoid fossa. Antihelix zones. The superior antihelix screws is an essential part of the auricular structure, divided into 3 distinct zones. The upper part of the superior antihelix screws includes AH1 anterior and AH2 posterior. The lower part of the superior antihelix screws is designated as AH3, while the middle and lower third zones are represented as AH4 and AH5 respectively. AH1, upper anterior zone. AH2 is the upper posterior zone. AH3, next lower zone. AH4, middle 1/3 zone. AH5, lower 1/3 zone. AH6, anterior and middle zone. AH7, posterior area. AH8 to AH13, lower divisions. Triangular fossa zones. TF1 corresponds to the upper area of the anterior 1/3 of the triangular fossa. TF2 covers the middle and lower areas of the anterior 1/3. TF3 represents the middle 1/3 of the triangular fossa. TF4 is located in the upper part of the posterior section of the triangular fossa. TF5 is found in the lower part of the posterior area. Tragus zones. TG1, lateral upper part. TG2, lateral lower part. TG3, medial upper part. TG4, medial lower part. Antitragus zones. AT1 is the zone located at the intertragic notch, the point between the tragus and the antitragus. AT2 is the middle part of the antitragus, situated between the upper and lower zones. AT3 refers to the posterior part of the antitragus. AT4 is the medial side of the antitragus. Concha zones. CO1 represents the anterior 1/3 of the lower part of the helix screws. CO2 is the middle 1/3 of the lower part of the helix screws. CO3 marks the posterior 1/3 of the lower part of the helix screws. CO4 signifies the terminal end of the helix screws. CO5 to 7 represent the upper part of the helix screws, divided into 3 equal parts. Detailed concha zones. CO1, anterior lower helix. CO2 middle lower helix, CO3 posterior lower helix, CO4 terminal end of helix, CO5 posterior upper helix, CO6 middle upper helix, and CO7 anterior upper helix. Earlobe zones. LO1 is located in the upper medial area of the earlobe. LO2 is the upper middle section, bridging the medial and lateral areas of the earlobe. LO3, the upper lateral zone, is the outermost section of the earlobe. LO4 represents the middle medial zone of the earlobe. LO5 is the middle central zone connecting medial and lateral sections. LO6, the middle lateral zone. LO7 is located in the lower medial area of the earlobe. LO8 represents the lower middle area. LO9 is the lower lateral section of the earlobe. Detailed earlobe zones: LO1 upper medial section, LO2 upper middle section, LO3 upper lateral section, LO4 middle medial section, LO5 middle section, LO6 middle lateral section, LO7 lower medial section, LO8 lower middle section, and LO9 lower lateral section. Dorsal surface of the auricle zones. P1 represents the upper portion of the dorsal surface of the auricle. P2 is the middle part of the dorsal surface. P3 refers to the central middle part of the dorsal auricle. P4 is the lateral part of the dorsal surface. P5 represents the lower part of the dorsal surface of the auricle. The auricular zones play a crucial role in TCM by providing insights into various health conditions. Understanding the specific zones allows practitioners to use auricular therapy effectively for diagnosis and treatment, enhancing overall well-being.
Let's discuss gua sha for diabetes, a traditional approach, exploring the role of gua sha in diabetes management through traditional methods. Diabetes is a prevalent condition resulting from a combination of genetic predispositions and lifestyle influences. In TCM, it is referred to as drinking and urine, primarily characterized by elevated blood sugar levels and common symptoms such as excessive thirst, increased urination, heightened appetite, and unexplained weight loss. Understanding gua sha. Gua sha is a traditional Chinese therapy that involves scraping the skin to enhance blood circulation, reduce inflammation, and support overall health. Particularly for diabetes management, it helps in promoting healing and improving pancreatic function, which is crucial for regulating blood sugar levels. The role of gua sha in diabetes management. Gua sha enhances blood circulation, helping to deliver oxygen and nutrients to tissues while removing waste products. Improving circulation can alleviate symptoms associated with diabetes and promote overall health. By reducing inflammation, gua sha can help mitigate the chronic inflammatory responses often present in diabetes. This reduction can lead to improved tissue health and reduced pain. Gua sha is believed to support pancreatic function by improving the flow of qi around the pancreas. This may help regulate blood sugar levels and support overall pancreatic health. The detoxification process is aided by gua sha, as it encourages the lymphatic drainage and the removal of accumulated toxins in the body, which can be beneficial for diabetes management. Common symptoms of diabetes: increased thirst sensation, frequent urination episodes, increased appetite levels, significant weight loss, fatigue, and weakness. Impact of diabetes on body functions. Diabetes can lead to diabetic retinopathy, a condition that damages the blood vessels in the retina, potentially causing vision loss. Kidney function, known as diabetic nephropathy, occurs when high blood sugar levels damage the filtering units of the kidneys, leading to potential kidney failure. Diabetes increases the risk of heart complications through elevated blood sugar levels that can damage blood vessels and nerves that control the heart, leading to heart disease. High blood sugar levels can damage blood vessels, leading to atherosclerosis, which increases the risk of heart attack and stroke. Diabetes can lead to peripheral neuropathy, a condition that affects the nerves outside the brain and spinal cord, causing pain, tingling, and loss of sensation. Skincare during gua sha treatment. Diabetes patients often experience increased glycogen levels in their skin, making it susceptible to infections from molds and germs. Thereby, it's crucial to apply scraping oil to protect the skin from gua sha treatments and to perform the scraping gently to minimize the risk of skin wounds and infections, especially in the less sensitive areas of the limbs. Recommended gua sha procedures, utilizing targeted scraping techniques to manage diabetes effectively. The corresponding area of the pancreas on the spine. We use the surface scraping and dual angle scraping from up to down. Projection area of pancreas on the body surface. Employ flat scraping on the ribs from inside to outside. Scraping tissue, shu, yang, and ishe. Scrape from bladder 20 to bladder 23 and from bladder 48 to bladder 49 on both sides of the neck of the back. Chong 1 and Chi Hai. Scrape from CV12 to CV6 from up to down on the abdomen, respecting Shen Che as the border. Yang Qi, Susan Lee, and San Yin Xiao press and knead San Xiao 4 on the wrist. Scrape stomach 36 and spleen 6 on lower limbs from up to down. Scraping the corresponding area of pancreas. This technique targets the pancreas, a vital organ for blood sugar regulation. By employing surface scraping and dual angle scraping methods, it is essential to scrape gently from top to bottom to facilitate pancreatic function and improve overall well-being in diabetes management. Next is scraping the projection area of the pancreas. This method focuses on the area corresponding to the pancreas projected onto the body's surface. By scraping from inside to outside on the ribs, it aims to stimulate and support pancreatic function, potentially aiding in diabetes management. Next, scraping Ishu, Shenshu, Yangkang, and Ishe. This method involves surface scraping along specific acupuncture points on the back to promote energy flow and support the function of the organs related to diabetes management. It is essential to use gentle pressure to avoid skin injuries, especially for patients with diabetes who may have sensitive skin. Scraping Changwan and Qihai. This method focuses on the abdominal area, specifically targeting Chong1, CV12, and Qihai, CV6. By utilizing surface scraping techniques, practitioners can enhance digestive function and overall well-being for diabetes patients. Scraping Yang Qi, Susan Lee, and San Yin Xiao. This procedure focuses on key acupuncture points that help regulate bodily functions related to diabetes. By using flat pressing and kneading techniques on San Gel 4 and scraping methods on stomach 36 and spleen 6, practitioners can stimulate circulation and alleviate symptoms associated with diabetes. enhancing therapeutic effects of gua sha. To alleviate excessive thirst, scraping fu, heartache, and Tai Yuan, lung 9, can help alleviate excessive thirst in diabetic patients by promoting better fluid balance and improving overall kidney function. To regulate appetite, for patients who experience increased appetite, scraping 18, stomach 44, and low gu, spleen 7 can assist in regulating digestive functions and reducing blood cravings, supporting weight management. To strengthen kidney function, patients who have frequent urination can benefit from scraping Tai Chi, kidney 3, and San Yin Tiao, spleen 6, which may help strengthen kidney function and balance hormonal levels, reducing the urge to urinate. Conclusions and recommendations. Gua sha offers a promising complementary approach to diabetes management, addressing both symptoms and underlying issues. Adhering to recommended scraping techniques and ensuring skin protection are crucial for maximizing the therapy's benefits and preventing complications.
Visual diagnosis of the eyes in Chinese medicine, exploring the role of eye observations in TCM and its impact on diagnosis. Visual diagnosis of the eyes is fundamental in TCM, providing critical insights into a person's health. This diagnostic approach focuses on interpreting the eyes as the reflections of internal organ systems, vitality, and emotional well-being, guiding practitioners in identifying imbalances and formulating treatment strategies. Chinese medicine versus iris diagnosis. Chinese medicine utilizes its own diagnostic methods that align with its holistic understanding of health, emphasizing the connection between the eyes and various organ systems. This approach allows practitioners to interpret visual cues in the eyes as reflections of the patient's overall vitality and specific organ health, adhering to TCM principles. Iris diagnosis, rooted in Western anatomical and physiological models, focuses on observing the iris to assess health conditions. This method may lead to incorrect conclusions when applied within the framework of Chinese medicine, as it does not consider the unique interpretations of organ function in TCM, potentially misrepresenting conditions like kidney imbalances. Understanding Shen and its significance. In TCM, the concept of Shen refers to a person's vitality, spirit, and consciousness, which is reflected through their eyes. The clarity and brightness of the eyes are indicators of Shen's strength and overall health. Observational signs of eye conditions. Understanding the significance of various eye observations helps identify underlying health issues. Heart qi deficiency, lack of eye contact. Liver qi imbalances, staring and piercing eyes. Heat agitating the shen, darting or restless eyes. Phlegm blocking the shen, blurry or matte eyes. Liver and heart qi stagnation, heart qi deficiency, lack of brightness. Zones of the eyes and corresponding organs. The pupil is associated with the kidneys and reflects their function in nourishing the eyes with essence and yin. Issues in this area may indicate problems related to kidney health, such as poor vision or dark circles. The iris corresponds to the liver and is an important indicator of its health. A healthy iris reflects proper liver function, while deficiencies can manifest as dullness or discoloration in the iris. The sclera represents the lungs and can show signs of health or imbalance through its color and condition. Redness or discoloration in the sclera may indicate heat or other lung-related issues. The canthus is linked to the heart. Changes in the inner or outer canthus, such as redness or swelling, can reflect heart conditions or imbalances. The lower eyelid is associated with the stomach and can indicate stomach health through its appearance. Issues such as puffiness can reflect digestive problems. The upper eyelid corresponds to the spleen. Its condition can reveal information about the spleen's health, such as signs of dampness or deficiency. Color changes in the eyes and their implications. Red eyes indicate heat. Yellow signifies damp heat. Blue reflects cold conditions. Green suggests liver wind. Inflammation and styes in the eyes. Inflammation and styes in the eyes can originate from two primary factors: an invasion of wind heat or internal heat that ascends to the eye area. The connection between the stomach and the eyelids plays a significant role in these conditions, where excess heat can lead to redness, swelling, and discomfort in the eyes. Tears and mucus in the eyes. The presence of sleep and mucus in the eyes can signify a buildup of phlegm, indicating underlying health concerns that may require attention. Watery eyes can stem from various issues, including liver imbalances or reactions to external factors like wind, suggesting disruption in the flow of qi and bodily fluids. Fundamental TCM concepts of the eyes. The liver is crucial in storing blood and nourishing the eyes, enabling clear vision and proper color perception. Healthy liver function is essential for maintaining moist eyes and good night vision. The kidneys provide vital essence, Jing and Yin, which support the vitality and overall health of the eyes. Deficiencies in kidney function can lead to various eye issues, including poor vision and dark circles. The heart houses the Shen, and its condition can be observed through the brightness and spirit of the eyes. Healthy emotional and mental states are reflected in bright, alert eyes, while dull eyes can signify underlying issues. Regions of the eyes and their correspondences. The sclera, or the white part of the eye, is primarily associated with the health and function of the lungs. Changes in the sclera can indicate respiratory issues or imbalances related to lung function. The iris represents the liver's constitutional vitality. Observations of color and clarity in the iris can provide insights into liver health and its ability to nourish the eyes. The pupils are linked to the kidneys and their essence. Observing the size and responsiveness of the pupils can reveal information about kidney health and balance. Eyelids are connected to the spleen, and their appearance can signal issues related to spleen qi deficiency or dampness. Observing eyelid conditions is important for overall health assessment. The inner canthus of the eye correlates with the heart. Changes in this area can reflect heart conditions, such as blood deficiency or heat. The outer canthus is associated with the small intestine and Yin-Yang channels. Observations in this area can inform about potential imbalances of heat conditions in these organs. Assessing Shen through the eyes. The quality of Shen observed in the eyes offers crucial insights into a person's overall health and emotional stability. Good Shen indicates bright, moist, responsive, focused, and calm eyes, reflecting healthy qi and blood. Poor Shen is characterized by dull, cloudy, lifeless, and unfocused eyes, often indicating severe deficiency or chronic illness. Common eye patterns in TCM. Liver fire rising is characterized by red and painful eyes, along with irritability. This condition often arises from emotional stress, anger, or excessive heat in the body, affecting the liver's function and leading to a fiery impact on the eyes. Liver blood deficiency manifests as dry eyes, blurred vision, and a pale appearance. It indicates insufficient nourishment from the liver, typically linked to excessive work or emotional stress, leading to visual disturbances. Kidney yin deficiency is marked by dry eyes and dark circles, reflecting a lack of nourishment and moisture to the eyes. This condition often arises from aging, prolonged stress, or illness that depletes kidney essence. Classical five-wheel theory, Wulun, of eye diagnosis. In TCM, the classical five-wheel theory divides the eye into 5 distinct areas, each corresponding to a specific Zhang organ. This framework emphasizes the relationship between eye health and the functional state of these organs, aiding practitioners in diagnosing systemic health conditions based on ocular observations. Important clinical notes for eye diagnosis. We use an integrated diagnostic approach. red flag symptoms awareness, and continuous education importance and pattern recognition in TCM. Visual diagnosis of the eyes in TCM provides crucial insights into the overall health of a person by assessing various organ systems. Key clinical observations include dry eyes indicating liver blood deficiency, puffy eyelids reflecting dampness, and red painful eyes suggesting excess heat. Recognizing these patterns enhances diagnostic accuracy and treatment efficacy, emphasizing a holistic approach that integrates multiple diagnostic tools in TCM. Understanding the Tan Balance Method System 6, an overview of Dr. Tan's acupuncture methodology for pain management and healing. The Tan Balance Method System 6 is recognized as the self-same meridian system in acupuncture, uniquely focusing on treating conditions by utilizing distal points on the same meridian pathway. This system, developed by Richard Tefu Tan, enhances the understanding and application of acupuncture by offering an alternative approach to balancing and healing within the meridian system, diverging from traditional methods that may pair different meridians. Dr. Tan's acupuncture approach consists of 6 primary systems, each with distinct methodologies tailored for various clinical presentations. The most widely utilized systems are 1 through 5, emphasizing different treatment principles and techniques. System 6 is less commonly practiced, but is essential for addressing specific ailments through a microsystem approach. It connects the hand, leg, and body through distinct anatomical points, focusing on the carpal, metacarpal, and phalanges in the hand, and the tarsal, metatarsal, and phalanges in the foot. Each of Dr. Tan's systems is designed with particular areas of use in mind, allowing practitioners to select the most suitable method based on the patient's symptoms and conditions. This flexibility enhances treatment efficacy and patient outcomes. In System 6, the core principle emphasizes that a meridian can balance itself by focusing on treatment through distal points along the same pathway. This approach allows for targeted relief while maintaining a strong connection to the affected channel, ensuring the treatment is both specific and effective. Characteristics of System 6: simple and direct approach, beginner-friendly techniques, effectiveness for musculoskeletal issues, ideal for evident channel pathology, applicable ipsilaterally or contralaterally. Advantages of System 6: immediate pain relief is observed, effective for diverse conditions, focus on same meridian. Common clinical uses of System 6: effective for acute pain relief, addresses channel obstructions, helps with tendinomuscular issues, localized treatment along meridians. Needling strategy for System 6. In System 6, the focus is on needling distal areas of the same meridian to promote healing and balance within the channel. This approach encourages the flow of energy along the meridian, facilitating quicker recovery from ailments. Direct needling into painful regions can exacerbate discomfort or lead to complications. Instead, practitioners are advised to focus on distal points that correspond to the affected area, ensuring a more comfortable treatment experience for the patient. Utilizing techniques such as mirroring, imaging, and palpation of tender ashy points enhances the effectiveness of treatment. These methodologies allow the practitioner to identify the most responsive areas for needling, optimizing the therapeutic outcome. Examples of System 6 applications. In System 6, acupuncture practitioners utilize distal points on the same meridian to effectively treat various pain areas. This approach allows for targeted relief by directly addressing the affected channel without the need for local needling. Mirror and image techniques in System 6. Mirror and image techniques are a foundational aspect of Dr. Tan's acupuncture method, allowing practitioners to utilize the body's anatomical reflections to address pain and pathology effectively. The concept involves using corresponding anatomical points on opposite ends of the body to create a therapeutic effect, enhancing the treatment's efficacy by utilizing the body's natural symmetry. Similar to the wrist and ankle, the elbow is used to mirror knee points, allowing treatment of knee-related conditions by stimulating the elbow region. The shoulder serves as a mirror for the hip, enabling practitioners to treat hip issues by targeting shoulder points, leveraging the interconnected nature of the body's meridian system. Step-by-step example, treating lumbar bladder pain. A practical guide to applying System 6 for effective treatment of lumbar pain. Step 1. Identify the channel. Assess the patient to determine the specific pain location and identify the Tai-Yang pathway and bladder channel as the relevant channels for treatment. Step 2. Select same meridian. Utilize the distal points along the bladder channel to treat the identified lumbar pain, ensuring that the treatment aligns with the same meridian principle of System 6. Step 3. Mirror image. Implement mirror and image techniques by identifying corresponding distal areas, such as the popliteal region, ankle, and lateral foot that reflect the lumbar pain area. Relationship to other Tan systems. Overview of the principles guiding Dr. Tan's 6 balance systems. System 1, interior-exterior, Piao Li. System 2, clock opposite. System 3, name sharing. System 4, clock neighbors. System 5, branching channels, relatives. System 6, same meridian balances itself. Clinical pearls of System 6. System 6 can be effectively integrated with other TAN systems to enhance treatment outcomes, utilizing a comprehensive approach to address varied patient conditions. Strong distal tenderness identified through palpation indicates the necessity of targeted treatment along the same channel, leading to enhanced effectiveness in pain alleviation and recovery. In chronic conditions, layering multiple systems, such as systems 1 to 5, can provide a more nuanced approach, addressing complex symptoms and promoting comprehensive healing. The Tan Balance Method System 6 is grounded in classical theories that explain the interconnectedness of the body's meridians. Key concepts include channel resonance, which illustrates how stimulation in one area of a meridian influences the entire channel, holographic body mapping that represents the whole body in smaller areas, allowing for targeted treatment, and self-regulation of meridians that reflects the body's natural healing processes. These principles emphasize how qi flows through pathways impacting overall health and wellness. The Tan Balance Method System 6 represents a significant advancement in acupuncture, emphasizing the importance of treating the same meridian for effective results. Gratitude is extended to all educators and practitioners who have contributed to the development and dissemination of this system, as their efforts have profoundly impacted the healing journey of many individuals.